Welcome to another edition of A New Me, your weekly consultation with the Washington, D.C. area's best doctors and professionals. Our guest experts help you learn about the latest medical advances and procedures by providing you with the real information necessary to help you eliminate the dangers of making the wrong medical and cosmetic enhancement decisions. Get ready for your consultation. Coming up, we will be on location in Vienna, Virginia, discussing advances in TMJ disorder treatment and how they can help relieve the associated headaches and pain with one of this area's top orthodontists, Dr. Brendan Stack. Dr. Stack earned his dental degree from Georgetown University and is a member of the American Dental Association and the American Orthodontic Association. Dr. Stack founded the prestigious American Academy of Craniofacial Pain approximately 30 years ago. Welcome, Dr. Stack.
Thank you.
It's our pleasure to have you on. It's your first time on our program, in fact, and I understand there's going to be a patient joining us a little bit later.
Yes.
In the interview. And I wanted to begin, however, Dr. Stack, by asking you if you can please tell us what TMJ is, because obviously it's a problem that's very common and afflicting a lot of folks out there.
It's a dysfunction of the temporomandibular joint, or the hinge joint in front of the ear, where the jaw fits into the socket in the base of the skull. It's the joint that's the most commonly used joint in the body, that you use whenever you talk and whenever you eat.
So talking about everyone talks and everyone eats, so it's something that obviously can cause a lot of problems.
Absolutely.
I wanted to follow up by asking you, Dr. Stack, what are some typical symptoms of TMJ?
Mostly they're chronic daily headaches that occur 5 to 7 times a week, migraine headaches, inability to open the mouth as much as the patient used to be able to, opening the mouth on a slant, cracking or grating or popping noises whenever they do open their mouth, fullness or stuffiness or pain in the ear, hearing loss, particularly in middle age.
That's quite a long list there of problems that quite a few folks out there experience, and some on a regular basis.
About 30% of the United States population.
My God, that's significant.
Yes. There are now effective treatments for temporomandibular joint dysfunction that can restore you to the headache-free period and vital life you once had.
Who would you say, Dr. Stack, would be a typical candidate?
Anyone from the age of 7 or 8 years of age to senior adults, anybody in that range. Teenagers frequently due to sports injuries, middle-aged people due to car accidents, or assaults, any kind of trauma. Anybody subjected to trauma is our patient.
All right, and I guess to the question that a lot of folks want to know, what would you say are some effective treatment options that can either minimize, if not eliminate, TMJ problems?
Well, all kinds of treatments have been tried. But when the patient is through with wishful thinking and they come down to dealing with reality, it comes down to wearing some type of mouthpiece 24/7, or wearing some type of mouthpiece plus surgery on the joints if the condition has gone too far before treatment is initiated. People can try meditation, they can try taking all kinds of vitamins and herbs and spices, but usually these prove to be ineffective in the long term.
All right, so that's what we're looking at as far as effectively taking care of TMJ.
If you want a permanent fix to the problem. If you just want relief to make the pain go away, that's very easily achievable.
All right, and how long would you say the typical treatment would take? Let's say the patient comes and you do a consult with them, you identify the problem, diagnose it, and I know each patient varies. It's not a cookie cutter solution as far as taking care of all the patients. It's each customized solution based on the specific problem or problems that each patient has when they come to you. So what, just I guess in general terms, what would you say?
Usually you can get the patient out of pain, regardless of its severity, in 2 or 3 days to 2 or 3 weeks. But getting out of pain, which is the chief symptom, does not mean the problem is fixed permanently. Frequently, it takes several months to a year or so to get it out of, to get the problem fixed permanently.
Considering many folks suffer from these TMJ related problems for many years,
Right.
and what a few weeks, a few months, even up to a year of treatments is nothing to eliminate that pain.
Correct.
Now, speaking of these problems and treatment options, we have a patient that's ready to come on, Dr. Stack. Welcome, Donna.
Thank you. I'm glad to be here today.
Oh, it's our pleasure to have you with us. We always appreciate it when patients take time in their busy schedules to come down and share their experience for a few moments with us. So let me begin on that note, if I may, by asking you, Donna, what dental problem or problems were you experiencing prior to coming to Dr. Stack?
So I met Dr. Stack in August of 2003, and I, at that point, was not a very functional person for probably over a year. I had, at that point, went to 17 other physicians from Johns Hopkins to the University of Maryland. I had difficulty walking. I had difficulty just doing the basic everyday things. I could not make meals for my family. I got to a point where eventually the chronic debilitating headaches crippled me, and I was basically bedridden. Well, I only have a life because of Dr. Stack's knowledge in this field, and I know that if I did not come here and receive this treatment, that I would not walk through that door, or any door, that I would still be bedridden and maybe not even be here.
My goodness, so he impacted your life on that level because, as you mentioned a few moments ago, Donna, you had gone to 17 different doctors, dentists, including some esteemed organizations like Johns Hopkins University and others, and nothing had helped your extreme and severe headaches that had literally, but you were bedridden. You actually were in a bedridden
Yes.
status. And
Yes,
you
I
came to
was.
Dr. Stack. What happened? You came here, he met with you, you did a consultation. How did you hear about him?
Well, actually, how I found Dr. Stack was at that point in my life, I had went to several physicians. No one was helping me, but I knew by common sense that something was very wrong. I was a person that worked 17-hour days, and I was now in bed. My husband would leave in the morning, and he would ask me, do you want me to carry you from the bed to the couch? And I would say yes, and he would carry me there, and that's where I stayed until he got home. I was not living, I was existing in a body that was no longer functional because of the debilitating pain, but there were no medical answers for this at the time. And you asked me how I came in contact with Dr. Stack. I had actually contacted a TMJ clinic in New York City, and my dad was planning to take me there. And in the meantime, he had contacted someone about taking the Amtrak train there. And they said, why are you going to New York with your daughter? And my dad told him why. And he said, well, they seem to think that she could have TMJ, but they're not positive. And there's a clinic in New York. But this person said, well, I know someone who has TMJ and they see a doctor in Virginia. Would you like me to find that information for you?
So basically, through that person, you found out about Dr. Stack, then you came to Dr. Stack here in Vienna, Virginia, and I take it he diagnosed the problem accurately, correctly, and more importantly, treated it to the point where you seem to be back to normal.
Exactly. He did correctly diagnose me. I can honestly tell you that the first day that I came in here, I rode in the back seat of my mom and dad's vehicle. And at that point, of course, I had my own life, my own family, a daughter, a husband, a home, a job, a career. And I was to the point where my parents were taking me like a child. When I came here, I did not believe any doctor on this earth could help me. I did not. And I put it in the Lord's hands, and I asked him, I said, God, just guide me to the person that you have given this knowledge to. And I'll never forget Dr. Stack saying to me, I was in one of his medical chairs, and he said to me, he goes, Donna, I do know what's wrong with you, and I can help you. It is not going to be fixed overnight. No two patients are going to receive the same treatment. This is not a cookie cutter answer. And I remember that day like it was yesterday. And I did not believe a word of it. But I know now, 8 years later, every single thing that Dr. Stack has ever told me, what I can do, what I can't do, what will happen to me when I do it, or don't listen, or am not disciplined, is exactly true. I cannot, there are really no words for me to share. This man has been given an extraordinary gift from God, and I just thank him for sharing that gift with me.
Yes.
Because I have a life because of his medical knowledge and understanding of the TMJ joint. It is absolutely phenomenal what this joint can do to the human body and how it can affect your speech, your walk, your hearing. And I could go on and on and on. It just forever amazes me.
Yes. Well, you know what, Donna? Very, very moving what you just shared with us, and very touching. And I'm sure that as you're speaking, that there are many, many folks out there who are going through what you went through 8 years ago prior to coming to Dr. Stack. And for you to come down again and just open your soul and your heart and go over everything that you were going through and how you feel today, which is obviously completely on the opposite end of the spectrum. You're functional, back to normal, busy, working, family. You have your life back, and it's through Dr. Stack. And
exactly.
I want to just thank you, Donna, for joining us and being a guest in our program, and just very, very moving and touching interview, because you really, again, I can't emphasize it enough, poured your soul out, and I want to thank you for coming down and taking the time.
Well, you are welcome, and it was an honor to be able to do this. I actually prayed about it because anytime that God gives me a platform that I can make a difference, no matter how big or small, I like to take advantage of that. And I remember a long time ago saying to God, I said, God, if you ever get me off of this couch and you give me my life back, I will serve you no matter where, no matter how small.
Yes.
Not that I didn't before, but when God puts you in a position like that, it really makes you count your blessings.
Yes, it
And
does.
I don't take for granted that I walked through that door instead of being carried through that door.
Yes, indeed. Amen. Thank you very much.
You're quite welcome.
We're now back with Dr. Stack. My God, such a moving interview with Donna. She really, her life had been turned upside down. Here was an active woman working up to 17-hour days, active family life, social life, had reached the point of being bedridden, demoralized, going through so much depression that was a result of the TMJ problems because it completely had affected her life, thought there was no option, and she came to you, and you literally are like an angel, Dr. Stack. You changed her life for the better forever. She's back to that active life, and very impressive and very moving interview indeed.
That's a very common story. We hear it all the time.
My goodness.
Well, she had migraine headaches for 25 years.
It's a long time.
Yeah.
My goodness.
Just imagine, her husband is my best booster.
Oh, my goodness.
He's got his wife back.
Yes, he does. He's got his wife back who has her life back.
Yeah.
That's wonderful. Great work, Dr. Stack. Are there any special patient instructions or restrictions when they're going through their TMJ treatments with you, doctor, that patients have to be aware of?
Well, a patient has to be committed to their treatment, and they have to be compliant. They have to wear these mouthpieces all the time. If not, they're better served by saving their own time and money and not even entering treatment. They just have to follow instructions, and things usually work out well. If they're not 100% committed, don't get treatment.
I got you. Now, when you say mouthpieces, you mentioned that a couple of times. What are we looking at? Is something that's you notice a little bit or feel a little bit in your mouth, or
It's something that's custom made that fits inside. It's not noticeable from the front.
Okay.
We have people wearing these in Congress and in the White House, and they can speak with them. There's a 24-hour adjustment period like contact lenses, but people get used to them. We have young children wearing them as young as 7 or 8 years old. We have old people wearing them. We expect them to be worn 24/7. If they're not worn 24/7, basically we don't even want to treat the patient.
Because that's the big part of the treatment is having that in to eliminate the TMJ problems that can be quite debilitating.
Right, and we want the tissues to heal, and we want all these good things that flow from that to occur.
Now, we're literally out of time, Dr. Stack, and you and your practice here in Vienna, Virginia, have certainly achieved a reputation of excellence within the field of TMJ as an orthodontist. You're very esteemed in your specialty. And Donna is just one of many, many patients that you have taken care of and treated and brought their lives back to them, literally. And I wanted to ask you, what would you say separates you and your practice apart from several of the others out there?
Well, we've been doing this 47 years, and so a lot of times we know precisely what the problem is, and we don't have to waste months and months of time trying one method and then abandoning it, trying another, all of which costs money to the patient. We more or less can hone right in and get results very, very quickly. It's better for the patient, it's better for us, it's better for everybody involved.
Yes, indeed. And not to mention, when they come to your practice, they meet with you, doctor. There's a lot of a personal touch here as well.
Yes, yes. I don't have any assistants. I deal with the patients directly, and everything is between them and me.
Now, on a side note, you are very, very much involved in a very important organization. It's called Parkinson's Research Organization. In fact, you were the keynote speaker just recently, if I'm not mistaken, a couple of months back in California at one of their gatherings, and I wanted to just have you share a little bit about that and the cause.
Well, we've noticed over the years that TMJ dysfunctions are very common to a lot of other maladies, such as Parkinson's patients, Tourette's patients, torticollis patients, if the viewers know what those are. And we don't treat Parkinson's disease or Tourette's disease, but we treat the TMJ symptoms associated with these maladies, and all of a sudden these patients' lives improve and they get significantly better, and all their associated symptoms get better. And the speech to which you were referring was, I was approached by the Parkinson's people to speak on what dentistry could do for the Parkinsonian patients, and they were just literally amazed. And we're continuing to do that. Now, we haven't done hundreds and hundreds and hundreds of Parkinson's patients because Parkinson's patients don't get referred directly to dental offices. But those that wander in here, due to word of mouth from patients we currently treat, get substantial improvement.
Well, that's certainly very good to know, and I appreciate you enlightening us on that as well, because that's I wouldn't have put the two together, the
Right.
tie-in with obviously dentistry and Parkinson's, but obviously there is, very much so, based on what you just said. So on that note, I would like to thank you, Dr. Stack. It was really an honor having you on today, and you're certainly very well respected in your field, not only locally but nationally, and very much involved in very important causes and education out there, one of which you just touched on. So thanks for joining us. We'd love to have you back on in the future.
Excellent.
Our pleasure.